Good morning. My name's Katelyn. I'm going to be your student nurse today. Can I, the doctor told me that the doctor's orders in the computer are that you need a Foley catheter insertion. Do you know what a Foley catheter is? Foley catheter is just a tube that goes into your bladder and it helps you urinate. It just stays there, held in by a balloon until you're ready to have it taken out. All right, do you have any questions? Are you in any pain at all? Okay, can I have your full name and your date of birth? Thank you. All right, I'm going to go ahead and raise your bed up. And I'm going to put this rail down. All right, I'm going to uncover you. And I'm going to close the curtains over here so that we have some privacy because you are going to be exposed for this. All right. Let me just get some gloves on here, and then we'll get started. Okay, I'm going to raise you up here. And I'm going to have you bend your knees and put your feet flat on the bed. Wonderful. Okay, I'm just going to clean you up a little bit here. All right. Just going to get some of my supplies ready. Okay. All right. I'm going to go ahead and get this opened up here. And it did fall back, so I would have to get a new one since it contaminated itself. I'm going to remove the sterile gloves from the field because I'm not going to be using these. All right. I'm going to go ahead and grab my drape. And slide it up under my patient. I'm going to remove the fenestrated drape because I don't need it for a female. And I'm going to apply my sterile gloves.
And I'll just have you feeling some pressure now?
Step back from my field here a little.
I can see the line coming out.
Okay. I'm going to go ahead and remove my tray and place it over next to my patient. Open up my iodine. Open up the lube.
Wash my hands. I'm going to put on some cleaners.
There it goes. Okay. And then I'm going to inspect the catheter tip here. Make sure everything's intact. And then carefully remove it from the plastic. All right, I'm gonna go ahead and attach my syringe so that I don't have to do it one-handed. Okay. All right, I'm gonna contaminate my left hand to perform cares. So I'm going to clean away, then near, and down the middle. All right, and then I'm going to continue holding the labia open, and I'm going to lubricate the tip of the catheter. All right, you're going to feel a little bit of pressure. Just take a deep breath in for me. I'm going to advance the catheter about 3 inches for a female before I see urine. And then I'll advance 3 more, just to make sure that it's in the bladder. And then I can hold. I just contaminated my sterile hand when I touched it with the contaminated hand. But at this point, the procedure is done. The sterile part of the procedure is done, so I can just go ahead and put the water in the balloon.
And here is your call
Inserting
line.
10 milliliters, which I'd make sure to put on the chart.
See you from the next station, okay? Alright, so just go ahead. I know my procedure.
I'm going to give this a tug to make sure that it's in the bladder correctly. Take the syringe off. At this point, I can go ahead and take this out of its box and clean up my field a little. I'll remove my sterile gloves, perform hand hygiene, put on clean gloves, perform peri-care to make sure that I've gotten all of the iodine off of her skin. Remove gloves again. Do more hand hygiene. Don more clean gloves. Then I'm going to secure the catheter tubing at the Y to the patient's leg. Ensure that all of the tubing is on the bed as much as possible. Hang the bag over the end. All right, I'm going to go ahead and put your legs down here. Cover you back up. I'm going to remove my gloves and perform hand hygiene again. Are you comfortable? Any pain at all? All right. If you have any questions or you need anything, your call light's here and you can call me and I'll come help you out, okay? All right, thank you.
Oh, you want one? Yeah. Because I thought you have one, right?
Let me lower your bed here real quick before I
I
go.
have one. I just because I want and I already destroyed one. It's enough. Okay, let me take it out. I'll put it in.
All right.
Okay.
Thank you.
Oh, yeah, box I don't know.
I paused this thing.